of patients, so a subgroup of patients are developing severe disease and a smaller subgroup developing critical disease. So I think that's what we have learned and confirmed over time and seen that same type of breakdown in different countries. We have also seen that we have learned with the recent release of the recovery trial that corticosteroids seems to be reducing mortality. And so why is that? So what is the mechanism for that? So I think that's something we still need to figure out more and understand more, but it does lead to the hypothesis that some virus-induced inflammatory state that is suppressed, that happens in a subgroup of patients that we need to better understand with the treatment of, that leads to, hypoxia, leads to needing oxygen, needs to potentially needing ventilation, with the use of corticosteroids, that is suppressed and potentially reducing mortality. So that's something, and over time people were describing an inflammatory response to the virus, and I think we still need to further understand that what biomarkers are elevated with and correlating with severity of disease to help us identify these patients earlier so we can apply treatments earlier. I think that's important. What else have we learned? Oxygen therapy, and I guess we go back to the basics until we have other known therapeutics that will treat the virus. We do know supportive care, so identifying patients early, those that are with complications, those that have hypoxemia, that need oxygen, to that the early interventions with oxygen therapy can be life-saving, and that for countries that are have limited capacity with oxygen, have resource limitations, that really surging oxygen systems is important, and making sure that the staff is trained in how to deliver oxygen, how to maintain oxygen supplies, and how to surge oxygen supplies is also critically important. So, thank you.
I think we have also Dr. Benedict.